I am happy and delighted on behalf of my little mini company, Associate Patient Advocates, to welcome our guest speaker who's going to talk to us about the joys of public health. Public health is something mostly in the shadows. We just expect that we're going to turn on the tap and have drinking water that is drinkable, and take a deep breath and air that is breathable, and go to the restaurant and have food that is edible, and go to the grocery store and buy lettuce that is not tainted with a variety of nasty substances. And of course, we kind of expect that we should not have our children, grandchildren exposed to things like polio, diphtheria, smallpox, and measles. And interestingly enough, when the public health system fails, or there is a failure more likely of the public will, you have things like you can't drink the water in Flint, Michigan, or Jackson, Mississippi. You get a recall of salads from 13 states because for whatever reason they're contaminated, or occasionally we have a slight pandemic. So with that, I'd like to thank Brenda and all the public health people, because doctors work one at a time, but the public health folks work on many, many hundreds and thousands. So Brenda has been the director of the chronic disease program for the Alameda County Public Health Department for over 20 years. She managed their diabetes, asthma, and 2 other adult programs as part of the Alameda County Chronic Disease Program. Prior to coming to Alameda County, she worked for several years at the California Department of Public Health Diabetes Prevention and Control Program, promoting the use of evidence-based guidelines for diabetes care. She is a past chair of the Diabetes Coalition of California, a participant of the Samuel Merritt University Ethnic Health Institute's Chronic Disease Committee, a graduate of St. Mary's College with a BA in Health Science Administration. I met Brenda because once upon a time we were running a diabetes self-management education program, and Brenda was kind enough to lend us her time and expertise, not to mention hard work and sweat, as a very valued member of that group. So with that, I'm going to have Brenda tell us all about public health.
Thank you so much. And thank you everybody for being here. So I will go through the list of things that I wanted to share with you. And then at the end, since I know you're all muted, I'd be happy to have any discussions or answer any questions that you might have. So just maybe jot them down and we can get to them in the end. So public health is in a variety of areas, and one of them is with the state. And in the state of California, I know some of you aren't from our county and some of you aren't from our state, but that's the one I know is this one. So in the state of California, we have something called CDPH, which is California Department of Public Health. And they're really there to protect us from infectious disease, to provide a reliable and accurate lab. They have a lab that actually does testing and did a lot of testing during COVID to look for what strains were happening, what was going on, and so on. And to provide information on health threats. So if there's a threat coming up, and recently we heard so much about mpox or monkeypox, and that was all over the news, and that was being shared by public health departments. So within the state, there are county public health departments, but within our state and some others, there's 3 cities who felt they needed to have their own public health departments. So Pasadena, Long Beach, and Berkeley all have their own public health department. It is not a part of the county's public health system. They function and operate just like the county. They often partner with the county. So it's not like they're out there just doing their own thing and running over all of us. We all work together. So that works out well. Within county public health departments, or within counties themselves, there are several health related things that are overseen. One of them is behavioral health, and I'm going to go into what all of these do. One of them is environmental health, epidemiology, and public or community health, which is really the division I fell under with chronic disease. In chronic disease, where I worked in the county, we had a diabetes program, an asthma program, an older adults program, a tattoo removal program, a women, infants, and children's program, which was a program for people who were of lower income, where they could, up until the age of 5, they could get groceries for their children through farmers markets. All this, anything they could get had been vetted by RDs to be healthy, so they couldn't buy just anything. And we, did a lot of work around pregnancy and infants and so on. And there was some work done, and not as much done, around men's health. And that is something that Alameda County was really trying to expand upon, because there wasn't as much being done around that. So public health works to improve the health of families and communities by promoting healthy lifestyles, which is like eating, dental, making sure people have dentists go to dental appointments, make sure they understand what it means. Sugar sweetened beverages. In Alameda County, we had a huge campaign on trying to cut back on that, especially for children, because it causes tooth decay and obesity. And then we look at things like obesity and exercise and what are people getting, and then preventing diseases such as we had to work on with COVID, and removing environmental dangers such as lead. So behavioral health, which is one component, works mostly on mental health issues. And in Alameda County, they are not necessarily the provider of those services, but they contract with organizations within the county that specialize in that. And they make sure that people have, both adults and children, have access to mental health. They're doing a lot of work right now. There's been a huge increase in the need for mental health services or behavioral health services since COVID. And it has to do with isolation and depression, and it's being seen across all ages. So they're really trying to focus in more on having those services available within schools for children. So that's one thing. And then environmental health works on a lot of different things. So like we had an algae bloom in Lake Merritt here in Oakland, and that can be detrimental to animals, especially if a dog goes in, they can die from it. So they'd let us know the algae bloom was high, stay out of the water, don't go near it. They worked on the dead fish that were coming up, making sure those were cleared up and gotten out of the way, and then working on when is it safe to go near the water again. They also do food inspections. So that is like the restaurants. They give them their licenses to be able to cook and serve food and so on. And they inspect the restaurants before they do that. They also do things around water, such as pools, spas, and beaches, mostly private. So they're not necessarily doing the pool in your neighbor's backyard, but they may be doing the community pool to make sure that the levels of chemicals are correct and that the water isn't bad for the people who are swimming. Also, hazardous waste. And hazardous waste is a lot of different things. And sometimes people don't always know what are all those things. So tires are extremely hazardous. And you may have seen several times where there's been fires in piles of tires, and that smoke is extremely toxic. So they work on making sure that that's not going to burn and not going to happen, and the tires are disposed of correctly. Batteries. In our particular county, we have a place, household hazardous waste, where we can take our batteries, or we can put them in Ziploc bags, tape them to the top of our garbage cans, and the waste management company will take them. Also paint. We can't just throw wet paint into the garbage. It has to be dried or taken to one of those household hazardous wastes because it's toxic. And propane tanks, cleaners, bleach, things you might have left that you didn't use up for cleaning. Electronics, a lot of people have electronic waste days where you can take in old computers, old phones, anything of that nature, and make sure that that's disposed of appropriately. And then one of the other things that people may not think of as much is something called sharps. And what a sharp is anything that you use to inject yourself or poke, like with diabetes, we have to poke our fingers to test our blood sugar. Those items are considered medical waste. And so we don't want people to just throw them in the garbage, because what happens is waste management people sort through garbage to make sure that things are going into the right section of the dump, and they get stuck by those sharps. And if they do, it becomes a workers' comp issue, because then they have to be tested for any kind of communicable disease like HIV/AIDS and hepatitis, other things. And it's not just people with diabetes who are using injectables. There are women who are pregnant and doing infertility, people with MS, people with ALS. A lot of different diseases require, even arthritis, require injections, and a lot of people are doing them at home now. I even had my vet one time tell me, here, take this and give your dog your own shot. So we have to dispose of them correctly. And there are sharps containers. There are these big red containers that people can get at pharmacies. Sometimes counties have them for free. And in our county, you can take them to the household hazardous waste and they will get rid of them properly. Our county also worked to get a program going where most CVS and other pharmacies have containers within the pharmacy where you can come and dispose of unused medications and sharps items. They have 2 different bins and you can put them in that. And then somebody comes by and picks all of that up. And one of the other departments is vector control. Vector control looks into things such as infestations of insects like bed bugs. When we're having a lot of problems with bed bugs, they will help people and show people what to do to get rid of the bed bugs. They can also determine if it is a bed bug. They can help people connect to resources to get rid of the bed bugs. They also look at things such as wildlife. So raccoons, skunks. January, I found out, was the mating season for skunks. And skunks were liking our house for some reason. And they were digging under the foundation and getting under there to go have their babies. And we had to call in somebody to come and actually remove them. And vector control participates in that. The other thing is body art, which is tattoos, piercings, and things like that. So they register and inspect the groups that do this. So they're looking at tattoos, piercings, branding, which I've never heard of and didn't know anybody did, but I guess they do, and permanent cosmetics. So if women go and have their eyebrows or their eye lines lined with a tattoo, so they don't have to get up every morning and put that on, they also inspect and regulate those organizations. Water programs, so they're looking at wastewater and they're looking at drinking water. And you may have heard several times during both the COVID and monkeypox people saying, oh, it's showing up in the wastewater. So those laboratories we were talking about as part of public health, they test the water and they look for communicable diseases and things that are maybe happening at this point in time, because it tells them a little better idea of what the statistics are around it, how many people really have it. Because in the very beginning of COVID, we were going to places to be tested. Then all these home tests became available and we were testing at home, which meant we knew we had COVID, but no one else knew. So public health didn't know, the state health system. So the count would have been higher for the number of people infected prior to that. And it went down some when we did home testing because it wasn't being recorded anywhere. So drinking water, they're also in charge of that and making sure that we have good drinking water and we're not like Flint or Mississippi and having issues. They also work on underground tanks, any underground fuel tanks that may be leaking. That's another thing that they're in charge of and take care of and get in on. And then I mentioned that the county actually does some other things related to health, but are not necessarily under the public health department. So we have a department called community development. And under community development, they have nurses who look at lab tests or work with doctors who do lab tests on children for lead, for high levels of lead. High levels of lead in water or paint, mostly in paint, in especially old houses. I think it's before 1976 or 78. Houses were, prior to that, being lead paint was being used. So they test, if a child tests for very high levels of lead, then they send out a public health nurse to check on the child because it impacts their ability to learn. It impacts their cognitive abilities and them staying intelligent. So we want to make sure that we take care of that. We've had trouble with water fountains at schools having lead. And so they look into all of that. One of the other things that we do is inspect jails, and we're inspecting jails for mostly what they're serving for food to the inmates. I was a part of that at one point. On one occasion, I got to participate, and they do not serve the best foods. Not that you're supposed to be in jail and have gourmet meals, but we also don't want them to have unhealthy meals, because then we also have to do the health care for those people. And they do have people with special dietary needs, and they need to be able to address those. So we go in and make sure that they're really staying on top of and doing what they should be doing. We also worked a little bit with their sheriffs, because we noticed their sheriffs tend to be a little overweight, and what were they serving in their cafeterias? And we tried to work with them to better understand what foods they should probably be thinking about eating. Let's see. And also foster care. The public health department and our counties are very involved in foster care. So children who are not able to live at home with their birth parents and are staying in a foster home with another set of parents are all managed by nurses who go and check in on them, and social workers who go in and check in on them. Also, adult protective services, which is the service that protects older adults to make sure they are not being financially abused, physically abused, any type of abuse that could be brought upon them, that is not happening. And they're there if somebody has to call in and say, hey, I think Mrs. So-and-so's son is taking all her money. And then they go in and they check on that. And also child protective services, which is if a parent is being abusive to the child, then again, a social worker and or a nurse will go and take a report and check to see what's going on and to see if there's anything that needs to be done to possibly remove the child or whatever. So all public health workers who serve clients or work in the community are considered mandatory reporters, which means if we go into a home and we see abuse, we are required by law to report that to one of these two services. And I have had in my program, my asthma program, which was for children, there was at least twice we had to do that and work with that program to help the kids. One, I had a child who had diabetes. He was getting up in the middle of the night while his parents weren't watching and eating 5 TV dinners and not taking any insulin and going to bed, and then waking up with very, very high blood sugars. And the parents were not taking care of it, not following up on it, and so on. And we needed to get him moved so that he wasn't going to end up having a crisis from his diabetes. And the judge made me, she said, you will go to Child Protective Services and get this taken care of. And so I did. We also, as a department, work on legislative things. So we are not able to lobby because that's against the law for us to do as a county employee. What we can do is educate. So if there is a law that we feel is important to the health of the public, and that we need to do some education around it to hopefully get it passed, we can do that. And so we have a group of a legislative branch who looks at things, looks at bills that are coming through and determines which ones might we need to have something to say about. And we do work on that. So that's kind of what every public health department is going to be different. It depends on the public health department. It depends on the needs of the community. So all will be slightly different. Most public health departments and counties are funded by taxpayer money. Most programs within public health are funded by grants. So I actually, for my 4 programs, I did not receive any public health or taxpayer funding, really. I had a couple of ones that I got a small amount, but everything I did, I had to find grants. I had to write grants. I had to find the money to pay for my personnel, to pay for the rent, to pay for everything else that a business would have to cover. So it's not just taxpayers' money and they're there doing whatever they want and having as much money as they can. It is much more runoff of grants. And I know that many other public health departments are the same way because I've met with and talked to some of them. So next I want to just go into, I'm not sure how many people this will relate to, but to go into some information about Alameda County's public health department. So if you're interested in looking it up, you can go to A as in apple, C as in cat, P as in Paul, H as in Henry, D as in dog.org. So that stands for Alameda County Public Health Department.org. And you can see the website. And on the website, there are various things that you can look up. So you can see the contact information, you get the address, you can get the phone number, and all the different departments that exist. And one of the things that shows up on the main site is any kind of health alert. So if we needed to give a health alert about something that was going right or wrong, that's where it would be found, and people can read up on it. Like COVID, there was tons and tons of information around COVID when we were in the height of it all. There's advisories for medical personnel. So if there's changes in vaccines or different things that they need to know about, it can be found there. Any kind of food or drug recall. So if there's a drug recall because something went wrong with it, it's not going to be out on the market anymore, it would be listed. Food recalls, kind of like what Dr. Schultz was talking about with the salads and the E. coli and so on, that would be listed as to brand names, what dates they were purchased, things like that. And we also do things around weather related things like fire, like heat advisories. So we about, I don't know, 3-4 weeks ago had just a horrible week of heat. And so what would be on there is cooling centers. Where can people go so that they can stay cool and not have to be staying outdoors or in a house with no air conditioning with 107 degrees, which we're not used to. So that kind of information is also available. Within our public health department, we had 81 programs. And I'm going to go over a few of those just to give you an idea in just a second. But we also have a site for communicable disease, which lists, gives you lists of diseases. It has reporting and controlling. There are some diseases that are required to be reported to public health departments. So if there is an outbreak in a school of something like measles, they are required to contact the public health department, tell them about the outbreak, tell them how many people, give them any information that they have, because the public health department is then required to follow that. And that is by law, we have to do that. There's information about immunizations there, and then there's contact information. There's also a list of all the clinics that are available in Alameda County. Alameda County used to have its own clinics and its own hospital. But sometime before I started 21 years ago, they decided to separate out and go under what's called a hospital authority. And it's now called Alameda Health Systems. And that is a culmination of maybe 4 to 5 clinics and I think about 3 hospitals now. And they are not, although they are who serves the low income and various other people, they're not a part of public health or the county itself. There's a section for reports. So Alameda County is one of the few counties that has something called epidemiology. And epidemiology looks at and traces and tracks diseases and trends and the numbers and statistics of what goes on within that disease. They did a ton of work during COVID. And not every county puts money into that, but Alameda County had and has for the whole time I've ever been there. They do reports by topic, so you can look up what's the prevalence of diabetes, what's the prevalence of high blood pressure within the county. One thing that they could be better at, but it's hard because the data that's collected isn't done this way. They do a lot of county data. They do not do a lot of city data, so we don't have as much information city by city, just because the bigger reports that come out where that's collected only do by county or state. They don't do cities. So that's someplace we've always said, hey, it would be great if we could do more there. And then there's a spot that's called About Us, which is a message from the Director of Public Health. It's the mission and vision of public health and more information about the CDC and the US Public Health Department. They have current vacancies, so if somebody's looking for a job, and information on how to contact them. So I was going to go over a few of the, I may need my glasses for this, a few of the department or the programs. When I said we had 81 programs. So air quality, especially since we've had a lot of wildfires in California, we've done a lot of work around giving people alerts about if it's a bad day for air out. You know, the quality is bad. We also have a organization that does that. The Air Quality Board does that. So we let people know if you have asthma or respiratory diseases, you probably don't want to go and hang outside. Another thing we've worked on through several different programs was getting air purifiers, especially during this time where we would give air purifiers to people with asthma or COPD or any other kind of respiratory issue that might require them to have cleaner air than what they were getting from a wildfire. Alcohol, drug prevention. Right now, you may have recently heard in the news this week that Santa Clara County is going to be bringing Narcan, which is a drug that is given to people who have overdosed to bring them out of the overdose, as long as they're not too far into it and they can come out. It's a nasal spray. It brings them out very, very quickly. And this last year, there was 135 deaths from overdoses on fentanyl in Santa Clara. So they're trying to bring it to the school districts, which is very important because we know that kids experiment and they try different things. And right now they're making the fentanyl in all these really fun colors to make it look like candy. That has been something that Alameda County has been working on and and the school districts have been working on. I do not believe they have implemented it yet. They were asking me about it just before I retired. And so I know they're working on it, but I don't think they've implemented it. But Santa Clara is most likely going to in the very, very near future. I think they got a $150,000 grant to buy the Narcan and stock the schools. So things like that. And then I said I had worked on an asthma program. So our asthma program would go to the homes of children with asthma. We would look for triggers within their house. We would teach their parents about what triggers are, because triggers can be a lot of things, like plug-ins that make your room smell nice, incense burning, lighting candles, not just pets and, you know, cats and dogs, things like that. There's a lot of things. Cooking, particulate matter goes into the air when you're cooking, especially if you don't use a fan, an exhaust fan. So we would teach them about that. We would give them supplies to help them manage their asthma, like an air purifier. And what we were doing was trying to reduce the hospitalization rates and ER visits for these kids, because it's very expensive. Plus, they don't need to be hanging out in hospitals and picking up on other diseases. So one of the things we did was about 45% of the kids who would come to us had been hospitalized in the last 12 months. And about 65% had been to the ER at least once in the last 12 months. And when we worked with them, that 45% of hospitalizations went down to 4%. And the 65% of ER visits went down to 14%. So definitely effective. We work a lot, like I said, on infant health types of things, breastfeeding, teaching women how to breastfeed. We have a California Children's Services, otherwise known as CCS, which takes care of children who may have spinal cord injuries or childhood diabetes, and there's nurses assigned to them to help them get their equipment, to help them get their testing, to make sure that their health stays in a good range. And so we work with them. Let's see, we also have a dental health program, which makes sure that kids starting in WIC, which is before they're 5 years old, get a dental exam, get a sealant. So a sealant is something that back when I was that age, they didn't have it, but they put the sealant over the teeth, which protect the teeth from getting cavities. And they do that with young children now. So they start as early as they can. And there's a program called Dreams, which is to work with mothers who have lost their babies, either during pregnancy or shortly after, like due to SIDS or whatever. So we do that kind of work. Family planning. I told you there is some fatherhood programs, but we wished we had more. And let's see, what other interesting, we have an HIV/AIDS program. We have a homeless program that does two different things. One is healthcare for the homeless. They make sure that people who are homeless have healthcare. And there are many clinics that are not a part of the county and ourselves who go into encampments and do healthcare work right there. And then there is healthcare. It's called AC Homeless or AC Homed. And it's to help people find some kind of sustainable housing. And they may help them with first and last month's rent. They get them into the facility. They have furnishings and towels and sheets and things you need to get a household started. that they help them get a start and help them stay there and teach them about financing and savings and so on. I told you about lead prevention. We have an emergency medical services program. That program works with we contract with the ambulance service for our county, and it works with all of the people within that system. So if they're a paramedic or an EMT, they work with them to get that registration and licensing and make sure they keep up with it, and they get continuing ed and so on. And they actually started a program for low-income kids mostly coming out of high school to do a training so they can become EMTs. And they developed that program as well. Let me see, what else do we have that's interesting? They do some work around rabies, which will mostly be with the animals and the bats, and will be that environmental health group I was talking about. And tuberculosis. So anybody who's coming into this country has to be tested to make sure they don't have TB. They have to be looked at. They have to have tests. They have to have chest x-rays, whatever it is. And it also used to be that everybody who worked in a school had to have the same. Now those rules have changed slightly, and depending on how their first test came out, depends on how often they have to do it again. But we have nurses who, if TB is detected in somebody, they go out, they deliver the medications, and when appropriate, because of the person and what they're doing or not doing, they have to witness them take the medication. So they may have to go every day and watch this person take a pill, make sure they've swallowed it. If there are issues with people and they say, I'm not taking it, I'm not doing it, they're not cooperating, they can go to a judge and get a court order. They can make the sheriff go out and make them do it. And that's how serious it is. They're going to follow up and make sure that TB is not going to be spread throughout our community. And that's just part of the law that they're able to do that. We also have vital registration. And vital registration is for in-home births. They do some of the hospital births and death certificates. They oversee all of that. And that all falls under public health. So there's a lot more going on in public health than meets the eye, you might say. And so I had a little bit of history I thought might be interesting for us with the light of what's been going on in the last couple of years. So everybody talks about the 100 years ago, we had this flu and there was all of this problem. Well, this pandemic was in 1918, and it was the H1N1 flu. And have we heard of that before? Yes, because in 2009, H1N1 was going through the populations then. So this was spread worldwide. This was also known as the Spanish flu. There were 500 million people, or a third of the population, infected by this in 1918. 675,000 US citizens died from it. 50 million worldwide died from it. It started in April of 1918, and the first reported case in the US was in Haskell, Kansas. It started right as World War I was starting. So we were all going around and spreading it to everybody as well. Another little interesting fact was that for the longest time, they thought the flu was caused by bacteria. And it was not until 1930 that they realized it was a virus, which is what then could help them find vaccines that could help to slow it down or prevent it. And that's why we have vaccines now. So that is my spiel, and I'm